To say it's been a challenge to secure personal protective equipment for local hospitals is an understatement. But the story of one such quest has made national news recently. Dr. Andrew Artenstein, Baystate Health Incident Commander for COVID-19 and Chief Physician Executive, spoke with Caroline McGrath and shares the story of how he and Baystate's supply chain team recently tracked down needed equipment and the many challenges they faced along the way, including a run-in with the FBI.
As you know, the normal supply chain for equipment for PPE and other things has really been overwhelmed by the demand nationally and globally. So some of our normal channels that we rely on for years in any health system have really been somewhat disrupted and are just not able to meet our surge demand. And we've had to look elsewhere in some non-traditional channels in order to get the equipment, keep our team members safe and protected while they're caring for these patients.
And when you talk about the normal chain of supply and all of that, you never in other circumstances would be involved in it, would you?
That's correct. We normally have, and we still do, we have supply chain professionals, procurement officers, and that pool has expanded greatly so that people can work all sorts of different leads and track down different ways to get the equipment that we need. It's not just PPE, it's all sorts of other things, but the PPE has been a major pressure point, as you know.
Tell us a little bit about how you became involved in this.
The professionals we have tracked down the lead, really vetted it well, determined that it could. It was a company with a track record, not one that we dealt with before, that had a track record in the area and had the potential to actually acquire the number of N95s and three-ply face masks that we were needed in this particular case. This was a few weeks ago, and it was felt that so many of these deals and agreements that we tried to make in the past, several weeks before that, had fallen apart at one point or another, many times at the very end when everything seemed that it was going to happen. It was felt that we needed to really take control of as many variables as we could. Obviously, we can't control the shipment coming from overseas, but we can control the testing what we get, making sure it's what we need and that it works properly, making sure the numbers are correct, and actually physically getting the materials from where they are sourced and bringing them back to our warehouse. I mean, those are things you don't normally have to do with supply chain for hospitals, but these are unusual times. And there's a lot of competition for a limited pool of supplies out there. So it was felt that at this point, we all kind of made the decision that it might be helped to have physician leadership involved, only to lend additional muscle, perhaps, emotional muscle more than anything, and also an additional pair of eyes that has some content knowledge about infection and transmission and this equipment.
So you met this shipment out of state, correct?
That is correct.
So you're out of state now. You're now part of the team that is going to try to secure this and bring it back up to Massachusetts. But it's almost unfolded like a movie, really. I mean, you had to bring trucks down that didn't look like they were carrying PPE. Is that correct?
That was the idea. And, in retrospect, then that may have been more than we needed in terms of caution. But I'll be honest with you, we decided that it was worth taking every possible precaution. We knew, given that this was a number of hours away and pretty long trip, that we would need to be crossing several state lines, including states that were significantly affected by the coronavirus pandemic, that we would have to be dealing with lots of different people. And the idea is that anything we could do to try to lend more confidence that it would really land on our loading dock. You know, the metric for me through this whole thing has been what is actually at our warehouse that we can control. Nothing is certain until it's certain.
Tell us what happened when you got to the warehouse.
Well, we got there in the morning. We met in mid-morning. I went by car. The supply chain professionals, several of them, and a fit tester. We brought a fit tester. That's someone who actually has expertise in assessing the seal that the masks form on the face. And that's important because all healthcare workers caring for patients need to have a fit test to ensure that there's an adequate seal, because there's a few different sizes of these masks. We brought those folks down. They went by small plane. I met them at the warehouse. We assessed some random sampling. We were able to, first of all, the supplies we expected to be there looked like they were being unloaded while we were there, which was a good sign. The boxes seemed appropriate. We were able to open a few randomly and select a few masks just for testing. Small number. You can only test a small number realistically. And but they worked. They were checking the boxes as what we expected and what we needed. So then we took the leap of faith, which I think is reasonable, that the rest would look similar. There were a number of them, a large number. And then at that point, we were met by a couple of FBI agents who we were told wanted to interview me and just verify credentials. So I went and talked to them, and the idea was that they were, which was surprising, but as I've said, these were some of the good guys, and I was happy to know that their interest in this. It was an initiative that was started. We were told that had started, that FBI agents were being deployed across, sort of fanning out across various parts of the country to ensure that such shipments were getting into the right hands. And the right hands, they told us, were hospitals, health systems, and first responders, which is exactly what I would like to see. And those are the hands that we were representing, actually. We're a health system and a group of hospitals. So we were all on the same page, and we were all trying to get the same goals met here. So that was good, actually. I assured them of my credentials. I think they felt comfortable that we were who we said we were, and that our intentions were the right ones. At that point, we were told the supplies would be released and able to be loaded onto the trucks. Several hours elapsed, where then we learned that there were phone calls in process, and there was people thinking through this thing on other ends about whether or not the shipment would actually be released, or whether it would be somehow reallocated or redirected. So that took several more hours, and that began to make us nervous that we might not be able to complete this.
So that was through the Department of Homeland Security?
That's what we were told.
So as people are listening to this, I mean, any other situation, this would never happen. And it almost seems kind of unreal that the federal government would be involved in this way, as it is, of course, trying to make sure that every hospital across the country has the necessary equipment. But to go through all of this, after you had secured it, you found it, you're paying for it, and it still potentially might not go to you.
Correct. At least that was our concern. It took several more hours of wrangling and phone calls and moving it up the chain in order for us to finally get this stuff loaded, released, loaded, and on the way back. And then by midnight, I was alerted that the PPE had actually landed on our loading dock and was in our warehouse behind lock and key and security guards.
So when you wrote this article, obviously it starts a broader discussion about what hospitals are going through in the midst of this. There
are a lot of people, it sounds like, with similar, maybe not exactly the same, but thematically similar stories. As opposed to any other disaster, a viral pandemic is such that it occurs in numerous places at the same time in the same time period. So what we're experiencing in the United States, across all of our states, some more than others, over the last 6 to 8 weeks, is just unbelievably unique for us across the globe as well. And so it puts a strain on every single gap in your system, and this is clearly a gap. And it sounds like others are experiencing this and kind of looking for some coordinated, orchestrated approach to this. It's difficult, but it's necessary.